We have 10,577 cumulative cases of coronavirus in Victoria. That's 627 new cases since we last updated you. I'm very sad to have to inform all Victorians that the total number of fatalities as a result of this global pandemic is now 112 people. That is 8 more than when we updated you from the podium yesterday. If further information can be provided, of course we will, but at this stage I'm able to confirm 2 men in their 50s, 2 men in their 70s, 3 men in their 80s, and 1 woman in her 70s. 4 of those 8 tragedies can be linked back to aged care. Can I again send my best wishes to and my sincere condolences to each of those families. This will be a very, very confronting and challenging time for them, one of great sadness. So we send our best wishes and our support to each and every one of those families. In terms of testing, we have now done 1,608,452 tests. That's 33,826 additional. In terms of hospitals, there are 349 Victorians in hospital. 37 of those are receiving intensive care. In aged care, the total number of active cases linked to aged care is 928, and there are some 1,030 health workers who are active cases as well. I wanted to just take people through a couple of updates, and then of course we're happy to take questions. First things first, you've heard me speak a couple of times now about the tremendous partnership between the ADF and authorised officers from the Department of Health and Human Services and the program of door knocking that they're currently undertaking amongst, in the first instance, those who can't be reached by phone who are positive cases, and that has now moved to a situation where all positive cases are being door knocked, and I think we will get very close. Today will be the first day where we've been able to achieve that. It's steadily building, as I think these numbers indicate. So since the 22nd of July, we are visiting each and every one of those who are positive. As I said, in the first instance, those that couldn't be contacted despite multiple phone calls, and now that's becoming a blanket policy, if you like, to all positive cases. Yesterday, so the 30th of July, was the second day of the big scale-up. ADF and DHHS conducted more than 500 visits. That's almost double the visits that were conducted the previous day at about 269. There are 34 teams of 3. It was 30 teams on the 29th of July and 18 teams on the 28th. So you can see that's scaling up, that's building. Disappointingly, I have to inform you that there were more than 130 unsuccessful visits, so around 1 in 4 people cannot be found at home. There will be a multitude of reasons for that, but what I can confirm for you is that more than 100 cases have been referred to Victoria Police. It is simply unacceptable for you to have this virus and not be at home. If you're out doing other things, there may be a handful who are out getting some fresh air. That does not explain these numbers. These numbers go well and truly beyond anything like that, and all that will do is spread the virus. So I would appeal to each and every person who's got a positive diagnosis, as well as each and every person who's waiting for a test result, as well as all of those close contacts. We've all got to do the right thing. We've all got to play our part, and particularly for those who are positive, then the only place to be is at home. It is just not, it's not acceptable, and no element of this strategy will be successful if, when we door knock you, we're finding 1 in 4 people not at home, they're somewhere else. Those matters have been referred to Victoria Police. That'll be a matter for them to investigate and deal with those issues on their merits. That is obviously a matter for them. Can I thank those ADF staff? Can I thank the DHHS staff that are out with them? Again, whilst it's important and there's no alternative but to focus on those numbers of people who weren't where they should have been, I would also just point out that this is not just about compliance, it's about providing information and clarity, and it's also about us saying to each of those families, because many of them, there may be 1 positive case but they live in a household, saying to those families, what can we do for you? Is there anything you need? And as I said yesterday, we've been able to have groceries bought and sent to people. We've been able to have scripts filled where people were not able to leave the house to go to a pharmacy. It's a long list of different support. So it's not just about checking, as important as that is, it's also about reaching out and providing support and care, as well as the information and clarity that every single person needs. Further to other commitments that I'd made in relation to updates, on the $300 payment, I can't give you a $1,500 payment update today, but hopefully tomorrow I'll be able to give you some further information about that. Again, it's a balancing act between pulling people away from processing payments to provide detailed reports. I don't think anyone needs that to happen. But so far there's been 5,200 people apply for the $300 payment. That's the payment that if you're waiting for a test and you're in insecure work and don't have sick leave to fall back on, then you can receive that payment. 4,200 have been paid out. That's around 1.26 million. There will be there will be a number of those 1,000 roughly that have not been approved. Some will be in process, but there'll be others who are on JobKeeper who did in fact have sick leave, who couldn't demonstrate that they were actually in the workforce. They're relatively small numbers. That is a very significant effort, and I want to thank all the team that have been working literally day and night to get those payments made. That's 4,200 families, 4,200 individuals and their close contacts, their close circle, who have not made a decision to go to work because of economic drivers. They've instead stayed at home and waited for their test result, and I'm very grateful to them. And of course I'm grateful to the team who are processing those payments. I was asked the other day just to provide an update on business support grants, and I'm happy to do that. We may well be able to add to this over time. But so far, 12,600 businesses have received the $5,000 grant. That's worth around $63 million in total. Other business support programs, you'd all remember, there was a tourism package where 215 businesses have been paid. There was some CBD support as well, but the other point to remember is that from the original business support fund, some 77,600 businesses have been paid the $10,000 grants. That's my latest advice. So we're making good progress on those. Obviously, we'll continue to process those applications. Many of those are not actually closed yet, so not everybody who will apply has in fact applied, but the team is working very hard to make sure that those payments are made and made in good time. Now, if I could just make a couple of general comments about where we find ourselves at the moment. The results today are essentially from Wednesday, because it takes a couple of days to process those through the various labs. Wednesday midnight actually marked the halfway mark of this 6-week lockdown, this 6-week stay at home, except for the 4 reasons. It is clear to all of us that these numbers are still far too high. It is clear that there are a number of factors driving that. Workplaces, people not staying at home while they're waiting for a test result, and we've canvassed all of those reasons. It's not about blame or judgment, it's just a fact. As well as these rather disturbing reports of people who've got it, know they've got it, and are still going about their business, together with the fact that once you've got significant community transmission, then those mystery cases, they grow and grow. So, I had a long conversation with the Prime Minister last night, very good talk about where we find ourselves. What I can report to you today is that both public health experts from the Victorian team, together working with colleagues at a national level, we'll spend the next day or so looking through in fine detail, analysing the data, looking for trends, looking to have a really clear sense of exactly what is presenting and exactly what the nature of our challenge is. That is essentially a halfway point analysis. I know that halfway was Wednesday, but when you count the laboratory time, we really are today talking about what was occurring at almost exactly at the halfway point of the stage 3 stay-at-home orders that we have put in place. That analysis, that thoughtful, careful, very considered and really important work will happen today, tomorrow, and then we will have more to say. I've got no announcements to make about next steps, but it is important that all of us acknowledge that these numbers are still far too high, and we could not open up with these numbers. We could not open up even with significantly less than these numbers. So it may well be the case and the data may well bear this out, and the best advice may well come to me, that we need to take further steps, that the steps we've taken are not enough to pull this up. It's appropriate that I share that with Victorians. That's not to cause a sense of alarm. That's not to feed people speculating about what those next steps might be. There's nothing to be gained from that. The data will tell us, the experts will tell us what, if any, next steps need to be, what the nature of those need to be, and indeed whether we need to take them. I just want to repeat again, each and every step that we've taken along the way, not just in Victoria but at a national level, has been guided by the very best public health advice. What's more, each and every step that we've taken has been, to the best of our ability, proportionate to the challenge we face. We face a very significant challenge at the moment. Today's not the day for announcements, and whilst there'll be obviously considerable interest in that process, I would just say to people, let's do that detailed analysis, and then when we have, just as we have all the way through, if we have further announcements to make, we'll make them at the appropriate time, and we'll take people through exactly what that means for them. But it is appropriate to acknowledge the very, very strong partnership between the Prime Minister and myself. Our phone call last night, we'll speak again today, and throughout the course of the weekend. Everyone is working together. The only priority, the exclusive focus, has got to be beating this thing, this wicked, silent enemy that is all about tragedy if we don't pull it up. I thought it was appropriate just to make those comments so that people are really clear on what's going on behind the scenes. That's exactly what needs to happen. That analysis is critically important. It will give us not just opinions and theories, it will give us the real-time clarity about what's happening with this virus right now and what we may need to do in order to drive these numbers down further. In terms of that effective reproduction rate, we are still hovering around 1, maybe just under, and what that means is that every positive case is infecting one other person. Unless we drive that number down so that every second or every third person who's got it is infecting one other, then we will not see our numbers halve and halve again and halve again. And we will be in this limbo where we've stopped it from getting completely out of control and our health system being swamped, but we haven't been able to suppress it sufficiently to, with any confidence other than an absolute certainty that numbers would get away from us if we opened up again, therefore we can't. So I'm trying to be as clear and as direct as possible. Today's not the day to speculate about what those measures might be. Today's the day to acknowledge that work is going on, and as soon as we've made decisions, as soon as advice is finalised to me, we'll be before you again and in detail trying to explain each and every step that we may need to take. I'm happy to take, and so is Brett, any questions you have.
Premier, you've repeatedly said that masks are our stage 4. There have been many people calling for stage 4 restrictions to be put in place weeks ago. Why haven't you done it yet? Why are we waiting until Sunday? And are you happy with...
Well, I'm not saying Sunday. And look, over the last 6 months, many people have called for many things, and there are many different people who've got lots of different views. What we do, what every state does, is follow the advice of public health experts. There'll be many different views. That's not an unhealthy thing. I'm not being critical of that. But we're not running a poll to work out what the best health position is, what the best public health policy decision is. We're listening to our experts, and they in turn are listening to what the data tells them. So there'll always be opinions. There'll always be views on what should be done and when. That's a perfectly reasonable thing. But we have always followed the advice, and that won't be changing. And I'm not indicating that at this stage, I'm not indicating that I'll be back here and I can indicate I'll be here, but I'm not indicating that there'll be a series of further announcements to be made on any particular day. I'm just sharing with the Victorian community that we have data that marks the halfway point of the 6 weeks. We have numbers that are too high. We have community transmission that is too high. And we need to do that detailed analysis and potentially take further steps beyond the current framework. That is exactly what I think Victorians would expect both the government and its expert advisors would be doing.
Can we just ask Brett? I mean, I know
Sure.
You've spoken a lot about the work, it's happening at work, but can you just give us your best guess where it's being picked up?
That will be in the data that we're looking at. We know that there are really significant workplaces where transmission's occurring, the ones that we've listed previously, and they really are those essential sectors. So aged care, healthcare settings, meat works, large warehouse and distribution centres, food production, food distribution. That's where we're seeing numbers for sure. But of course there's a concern that there are other workplaces where maybe they're not so visible because they don't lead to explosive numbers of cases. We don't see outbreaks manifesting, or maybe they've got a very young workforce, mostly with mild illness, contributing to transmission but not necessarily showing up in the numbers or showing up in hospital because they're not as at risk of severe disease. So that's part of the deep dive that we're going to do, that we've always been doing, but that we're really looking into now, today and tomorrow. Clearly there's a concern that there's a broader cross-section of workplaces, transmission between workplaces and home and back again, that's contributing to the significant numbers. I should say, you know, it's dispiriting to see big numbers, and we all rise and fall with the numbers every day. The stage 3 restrictions had a really significant impact, and people should be gratified by the fact that that's the case. The effective reproduction number was probably, you know, at 1.75 or close to 2. It's come down to 1. But as the Premier said, we can't sit with 400, 500, 600 cases a day ongoing. We have to drive it down even further. And so that's part of the deep dive into the data to understand.
So what's stopping you preempting? Because you didn't wait for a lot of data in other times. So why wait for the data this time?
Well, we've always looked at the data on a daily basis. We've seen modelling that suggested that we might tip over and have numbers reduce. But every day that we see numbers, every day that we see different settings and transmission occurring leads to a re-evaluation of how that's going. And obviously, when different cohorts of the population are affected, or it's spilling out into a different age group, a different geographical area, a different subsection of the population, that drives a different transmission. And so we have to review time and again. We've obviously had a number of interventions that have been very successful with the stage 3 restrictions. We've had other interventions that have come into play just in the last 2 weeks, including universal mask use, which has been modelled to have a really significant impact. That may or may not be playing out now. We've got increased workplace compliance. We've got increased oversight of cases and their close contacts. So all of those are new interventions that will show up in the data, but they're not necessarily there yet for today.
So for we laymen, can you explain over the next couple of days what will actually happen? A whole lot of people in one room, or just so give us paint a picture of what is actually going to be happening and who's going to be involved? Yeah,
it won't be a whole lot of people in one room. It'll be a whole lot of people on Microsoft Teams or Zoom or whatever, talking through those numbers. The detailed analysis really relates to who, where, how, why. And that's the age groups, the occupational groups, other demographic data in terms of country of origin or language spoken to understand where the transmission is concentrated, and to really explore those hypotheses of where transmission's occurring and what needs to happen in order to really suppress that transmission. And we've obviously had a lot of focus on those high-risk areas, and I'm sure that that's made a difference in those areas. But there's two questions. One is it enough? And two, are there other settings that we really need to explore in terms of making sure that people aren't in those workplaces infectious, or in those workplaces as close contacts, or potentially infectious developing illness?
Right, yesterday there were 500 or just over 500 healthcare workers affected, and today there's 1,030. Where are those healthcare workers, and is there enough protections for them?
I think I've said before, Andrew Wilson in Safe Care Victoria, our Chief Medical Officer, is looking into the healthcare worker infections. That work will probably be complete this week. We know it's a mix of aged care workforce, doctors and nurses in our acute care settings, but also many of the other ancillary workers in acute care. It's a huge concern to see healthcare workers developing illness. it is not always straightforward to understand how they've acquired their illness. We have to be open to the fact that personal protective equipment may or may not work in certain circumstances. It's been provided to everyone, but there's always a review of is it sufficient, is it being used properly, is it being used in all settings, in all circumstances where transmission might be occurring. I'm certainly not jumping to a conclusion that healthcare workers are only getting it outside of their workplace. That is not the case. Transmission is a risk within workplaces, but we do need to dig down to it to understand exactly how that's happening.
Last week you said there's no evidence that a stage 4 or a New Zealand style lockdown would work here. Do you still feel that way?
I think that's what we're exploring now. Obviously, a step up in restrictions is a really significant measure, but we are wanting it to be informed by evidence to the fullest extent possible. It gets to that point of being proportionate. There are, really significant consequences for what you do in terms of increased restrictions, and so it has to be focused on what the data tells us about where transmission might be occurring. It may be the case that an intervention in a certain area will make a difference. It may also be the case that we, look at restrictions in an area that are not a driver of transmission, and that would be an unfortunate impost and unfortunate consequences for everyone who might be involved there. So that's really what looking at the evidence, looking at the data is focused on.
How much consideration of the impact, talk about proportionality, how much of an impact on, say, businesses' employment would be made as part of those considerations in a further lockdown?
Yeah, it's absolutely, the impact on businesses, the impact on people's livelihoods, on their psychological and emotional well-being are all part of those considerations. And I've said before, these are impossible decisions in lots of ways. We are balancing harms, the harms of what increased cases over time would be and the unfolding aged care tragedy that we've got right now, and all of the other consequences that happen when you've got increased restrictions. So it's a balancing. We absolutely have to get these cases down, because if we don't do that, there will be ongoing consequences for everyone into the future. But we're totally mindful of those broader impacts.
Rich, I might just add to that if I can. In my discussion with the Prime Minister last night, there is a complete acknowledgement that there can be no economic recovery until we deal with this public health challenge. It is incredibly difficult. In fact, it's almost impossible for us to see businesses recover and survive unless and until we get these numbers down. And that will mean there is a significant impost. It may be that there is further support that is needed for businesses, for workers. Part of my discussions and dialogue with the Prime Minister will focus on those issues as well. And again, that's why I'm grateful for such a positive partnership, one that is all about dealing with the challenge. These numbers are too high, and for so long as they remain too high, we will not be able to open up, we will not be able to find a COVID normal. We will still be in this limbo where we've stabilised. We have, to the best of our judgment, we have avoided our hospital system being completely overrun, but we're not seeing those numbers fall sufficient to be able to bring an end to these restrictions and move into a much more open economy and a much more open Victorian community.
Did your talks with the Prime Minister involve any more requests for assistance or sounding out other states for potential help?
No, not as such, Lundy. We did have a conversation about, only moments before I spoke with the PM, I had just finished a very lengthy meeting that I was chairing, particularly about aged care. So we talked about a couple of issues there, particularly issues, for instance, and this is just feedback that's come to us. I'm sorry I can't give you a full breakdown today of how many shifts have been worked by hospital nurses and some of those other things. I'd hope to be able to do that tomorrow. But in very broad terms, there is a stability that's come to those 4 or 5 crisis sites, certainly the 4 that we've talked a lot about. But for instance, we had a discussion about some issues in terms of connecting family members with residents in those 4 now stable, but previously very challenging, very confronting aged care settings. So we talked about a few of those sorts of issues, but we've got support from right across the country. We're very grateful for that. We've got support from the Prime Minister and the national government, and we've got support from industry and from every part of the Victorian government. Many people who would never have thought they'd finish up working on something like this, but they are doing everything they possibly can.
Is there any suggestion, Premier, you've talked a couple of days now about ADF turning up people who should be home and not.
Yes.
Is there any suggestion of increasing penalties?
Not at this stage, Nick. I would say this, on-the-spot fines are that's $1,652. That's not an insignificant number. If those matters go to court, it jumps up to around $10,000. That's obviously a very significant impost for anybody. We think that those penalties are appropriate at this stage, but I would just say to you, if Victoria Police came to me and said we need to change that, we need some further tools, then I wouldn't hesitate to look at that. That's not the advice, and I don't know that necessarily increasing the penalties would drive much better behaviour. The fact is now, those 100 people have been referred to Victoria Police. The fines are significant. They perhaps thought that they wouldn't be in the frame, that they would be able to, ignore their positive case, the fact that they have this virus. I think they were very foolish to do that. But just as there's that very bad behaviour, very bad choices, they're also finding a lot of people who are at home doing the right thing. They're also finding a number of people that we need to help and support, and we are. And many people are very, very keen to just have a chat and to confirm that they're doing the right thing. So I wouldn't want to detract from the overall majority of people who are working very hard to play their part, but those numbers are well too high. And if for heaven's sake, you've got it, you have to stay at home. You can't be pretending you don't have it. And it doesn't make a lot of sense when you think about it. You had the presence of mind to go and get tested. We're grateful for that. You've got the virus. You need to stay at home. That's a pretty simple request. I must say though, we've talked many times now about that kind of economic hardship, not getting paid, not having sick leave to fall back on. I am heartened to think that 4,200 people have been paid that $300 payment. I'll come back to you probably tomorrow or Sunday in relation to the $1,500 payment, but people are working around the clock to make those payments. That says to me that many people, that we were right to acknowledge that that was a driver, but again, we can only go so far. We need people to do the right thing, and it's not that complex, and it's not that much to ask. If you've got this virus, you've just got to be at home.
Is there a need for greater surveillance then?
Sorry?
Is it need for greater surveillance of those people?
Well, I think the key point here is that we are in partnership with the ADF visiting every single one of those positive cases. Sorry?
Does it need to be more frequent if it's just once a day?
Well, I wouldn't rule that out. Again, if I get advice that says, look, we need to be door knocking more often, that's a big task though, obviously, as case numbers continue to grow. Like total active cases is a very significant number, pushing 6,000. So that number changes each day as some come out of that active group and others join it. But I would have thought that the mere sense, and we'll get this out not just through you guys, we're very grateful if you can assist us, but we'll get that out across all platforms and all different mediums to make sure that people know that if you're not where you're supposed to be, you are going to get door knocked and you will get fined.
Premier, just on the $1,500 payment,
yes.
Why haven't you been able to provide a tally, and is it perhaps that it's being undersubscribed?
No, I think it's a very significant number of people. I just didn't. I had got an update in relation to the $300 payment, which I think is in many respects the biggest driver. People who are going to work while they're waiting for their tests. I'll be able to give you an update at some point, probably at tomorrow's briefing.
Can we just ask about healthcare workers? I'm
Yes.
not sure whose question it is, but firstly, they're concerned they want a higher level of PPE. There's more evidence coming through that it's aerosol infection and not surface infection. And do you know how many workers are in isolation, so just waiting to see whether or not
How many are furloughed? Ralph, I think it's probably best if we try and provide you with a breakdown amongst those healthcare workers who are active cases in the Chief Health Officer's media release later on today. Any further information we can provide you, we will. I think that there will always be debates and discussion, and that's a very healthy thing as people test whether all the protocols are as they should be. This is a novel virus. We learn about it every single day. We're learning new things. The international evidence changes. There's never probably been more medical journal articles, more studies, more evidence coming forward about anything in such a compressed, such a compressed period of time. And people in the profession, those who support them, all of us are reading those articles and are obviously concerned. As I've said before, the courage and compassion, the care and skill that our health team provides, if you honour that, if you want to support that, then you've got to stay home. You can't go to work when you're sick. You've got to get tested quickly. You've got to stay at home and wait for your results. You've got to follow these rules. That's just a must. Otherwise, you put yourself in danger, other families, and in an absolute sense, you put the people who are there to care for us in absolute danger. And that's not acceptable. It is just not acceptable. No one should be contributing to the risks and increasing the risks that our nurses and doctors, our AMBOs and the whole team in our hospitals are fundamentally exposed to. No one should be increasing the risks that our health professionals face. That's just not on.
After your conversations with the Prime Minister
Yes.
yesterday, has he given his blessing in a way for us to move to stage 4, in that if the health advice is yes, we need to move up, considering the federal government's paying things like JobKeeper, JobSeeker, he said, I can give you the economic support you need for that?
I wouldn't term it in. I wouldn't characterise it in those terms. Ultimately, we've got to make decisions around public health and restrictions. That's part of the National Cabinet framework. But it's always best if everybody works as closely together as they possibly can, and that's exactly what has happened all the way through this. And now I think we're in a really critical time as we mark results that represent the halfway mark of this 6-week shutdown. I'd hope that there was some comfort for Victorians to know that both governments are working very closely together. The public health experts, regardless of who they work for, who signs their paycheck, they're all working on a really granular understanding and a proper and detailed analysis of this data, even more than has been a feature to this point, so that we can make really well-informed decisions based on the very best of advice. To know that all governments are working toward that one common aim, and that's driving these numbers down, defeating this virus, so that we can open up again. I would have thought that was good news and a really positive thing. Certainly that's the way that I interpret it.
But
Can
I
you
think
make
if
it
we
as
do
a
have to
major
move to
mask?
restrictions,
So we go.
sorry, if we do have to move to restrictions, just to see how long this would be effective for, would it essentially have to go for 6 weeks?
No, we would need to come back to you. So there's a few ifs and buts in there, and that's why I think it is. I understand where the question comes from. That's perfectly fair, but it is best. That's why I said before. Today's not the day. Today is the day to share the fact that we are doing this detailed work. This data will inform the advice, and then the advice will inform whatever settings we need to put in place as part of a next step. Exactly what that will be, when it will be, how long it would need to operate for, all of that would be for another day.
There is a major...
We go Lundy and then Nick. Lundy.
Your reference, given what you said about the lag time, would you have data from showing the effectiveness or not of the mandatory mask policy before you make this decision on next steps? Or
We'll have some sense of it, Lundy, but we've often talked about all the different challenges of this thing, and part of its wickedness is that people can have it and not know. The other challenge too is that because they're these 2-week cycles, you don't get a clear picture in real time. You're always a little bit behind in terms of what you're seeing and what the impact of the measures and the steps that you've taken. I can't with any certainty say that we've got a complete picture. You can never really have a complete picture, and that's why you've got to make these really difficult judgments. And there are significant consequences whenever you make one of these decisions. All of that's part of the work that we'll do in the coming days. All of that has been a feature of each of these decision points for the best part of 4 months, which does seem much longer. Yeah, Nick, sorry.
There's a major Islamic festival which has become
Yes.
Professor Sutton released a message on yesterday.
Yes.
Has the government reached out to Islamic leaders?
We have.
And how do you intend to police it?
So the Eid al-Adha, the second Eid, is a very significant, very holy and special time for our Islamic community. but it needs to look incredibly different this year than it has ever looked. By staying apart, we keep each other safe. By staying at home, we keep each other safe. And I've also recorded some messages, and they'll be a feature of different channels and different platforms. I have the highest regard for the hard work and the commitment and the passion of our Islamic community. They're great contributors to our state as a whole, and I know that they'll heed this message and they'll do everything they possibly can to keep both members of their community and indeed the entire community safe. It needs to look very different this year. That doesn't detract from its very significant place in the Islamic calendar. Normally, many people would be travelling. Hajj would be happening. That overseas travel is simply not necessary, so it already looks different, and it needs to continue to look different. And I'm very confident that the Islamic community will step up.
Will there be a need to police it?
I wouldn't think so. We're not about trying to police individual groups. We police everybody equally and fairly, and it doesn't matter what motivates anybody. What the cause of breaking the rules might be, everybody will be policed fairly and equally. Can I just again, I know I've done this a couple of times, but he's such a special Victorian. Can I just thank Bashir Hooley for his leadership? He is a genuine community leader. He's not just a footballer. He is a genuine community leader, and we send our thanks to him for his very strong and consistent messaging and his leadership within his community, and we also send our best wishes to him, knowing that his mum is still very sick.
Premier Sarah Albert here from 60 Minutes. First of all, thank you to the team and those behind the scenes working hard to contain this and
Sure.
keep us informed. And I appreciate the sensitivities around this, but back in 2018, the government ordered a review into the security industry. Why did you order that review?
Well, we've outlined our reasons for that at the time and since.
So what were the reasons behind
Well,
this?
I'm not going into matters that were totally unrelated to the matters I'm talking about today.
Well,
That
that's
are
related because it's, as
well,
we know, a breach.
why don't I get you the media releases from the time? They were election commitments and they've been honoured, but I'm happy to get you the details of that.
I've read the details, I've read the releases, and I've read the documents that are out there. Just curious as to why the government found it necessary.
Well, I hope your curiosity is dealt with via reading those media releases. I don't have those media releases in front of me, and I'm not here today to talk about the security industry.
But the security industry is where we find ourselves now, isn't it?
Well, we have another process that's going on, and that should be allowed to run its course. It'll make those judgments, not me. And with the greatest of respect, they will be the forum. That is the forum that will determine exactly what happened.
Do you know much about the security guards themselves that were deployed to this critical role? And some of them had less than, they need less than 2 weeks training to become a security guard. Obviously, they don't have the health requirements necessary for this kind of role. Do you appreciate that perhaps these people weren't the right people for this role?
Well, as I've said to you, that's not a matter for me to determine. That is a matter for another process. And the former Judge Coate will do that work. She's in fact already begun doing that important work, and that will get us a report, findings, recommendations, and we'll deal with those once that process is finished. She has very broad terms of reference. She has an expansive budget. She has everything she needs to give us the answers that we're all fundamentally entitled to. But with the greatest of respect, it is not for anyone in this room to pretend to be a former judge and to pretend to run a second judicial inquiry in parallel with the one that's already been set up in accordance with Victorian law.
So if we could take it then that if a review was called into this industry, that there was an understanding or acknowledgement that there were shortcomings within that industry?
Well, as I said, you can have a look at the media releases that were issued at the time. We've got a process that's underway. It's a very important process. I'm not going to undermine it by pretending that I should be sitting in judgment on myself. I don't think that's a very good thing to do. The best thing to do is to allow someone at arm's length from the Victorian government to establish exactly what has occurred here. That is my answer. That is a position that has not changed.
There are
And you
more than
had
10,000
brilliant-
cases now in Victoria, more than 10,000 Victorians reported.
I'm very much aware of how many cases there are. I stand here every day and report them. Thank you, but I'm very well aware of how many cases there are.
Well, there is frustration in the community that we are here. You're frustrated as well, we know that too.
No, I think there is a very big challenge that we all face, and I'm very much focused on dealing with that challenge.
Why weren't the police used?
Again, whilst I'm very pleased to welcome you to our briefing today, I think I've answered all your questions. I'm not going to sit here and pretend to be running a judicial inquiry. It's being run by a former judge. That's how judicial inquiries work. I don't I don't want to be discourteous or disrespectful in any way. I have answered these questions many different times. I would again confirm for you, we have a process. It is not about the government sitting in judgment of itself. It is at arm's length as it should be. You're freely entitled to ask any questions you want, but my answer and the government's position in terms of this being an at arm's length independent process will not change.
Do you know
Respect
if
those
you're,
questions being asked because the answers aren't there.
Because the answers are to be provided by the retired judge and the judicial inquiry. I think that's the point that I'm trying as politely as I possibly can to make.
There's
do
been
you
protests
know,
this morning.
have you had a preliminary discussion about whether or not you or your ministers will be asked to appear before the inquiry? Do you know?
As I've said, we will assist the inquiry in any way we can, and that who's called and the whole conduct of that inquiry is entirely a matter for Judge Coate. She's got and counsel assisting, and if she requires people to appear, then of course every person who's asked to appear should.
I was just asking if you had a formal invitation or preliminary.
As I said, we have confirmed for Judge Coate, she's in no doubt whatsoever that any and all assistance that's required will be offered to her.
There's been protests this morning at the
Yes.
time of remembrance. Should all of those people who attended be fined either for being there in the first place or for not wearing a mask?
That's a matter for Victoria Police, but I think from experience, we know and understand that Victoria Police are out there finding people who aren't wearing masks. Victoria Police are out there finding people who are breaking the rules, whether it be a so-called protest or some other event. It doesn't matter the setting, doesn't matter the context. If people are just willfully breaking the rules, then they will be dealt with by Victoria Police. They'll be fairly treated, of course. Everybody should be, and they will be. No one should be protesting. The only thing we should be protesting or fighting against is this virus. And protests are not conducive with that fight. They will in fact do nothing but help to spread this virus. It is the wrong thing to do. It should not be happening.
Karina, earlier this week you talked about shutting down some industries, possibly that, including meatworks. What sort of data are you waiting for before you make those decisions, given that we're seeing meatwork cases increase every day?
Well, there's been a very significant policy response, lots of different things that have been done, steps that have been taken in relation to meatworks and other high-risk settings. In terms of, it's not a matter of waiting, it's just a matter of getting the full picture, the clearest picture, and then making decisions that do have very significant impacts. But I think it is important that we focus on the fact that there's a lot that's occurred in meatworks, and I want to thank all of those providers, all of those businesses who are doing the right thing, working really hard with us to try, and workers I should say, to try and drive down those numbers, as well as an enormous team that are dealing with the different outbreaks that we've seen.
Is there a
Have you seen
possibility
enough-
to shut meatworks though down as an industry, given that it's essential in food production?
Yeah, I've made the point a couple of times that one of the challenges we face is that many of the settings where we have seen significant outbreaks would, on any given list, most likely remain open. That is a significant challenge for us. Next steps will be as much about mystery cases out in the community as they will be about outbreaks in large workplaces. If I can, that's an important point to make. So you can have meatworks well in hand, you can have all the processes that we've got in place, but if numbers are still growing and you've got a sense and the data is starting to tell you that there may be more community transmission that's unrelated to those workplaces, which there's still less of a problem, but dealing with that may need a broader set of policies that may need us to take further steps.
So how many of those mystery cases are we getting per day at the moment?
I think we can probably give you a breakdown of community transmission. Won't be for today because those cases will still be being investigated, but we'll be able to give you in the show release a sense of where those numbers are at.
Does that mean things like greyhound racing, which is currently classified as an essential service for some reason, maybe shouldn't be classified?
No, Lundy, I don't think it's about. I think the word essential has been essentially redefined over the last months. We have a number of things open where they pose a low risk. That doesn't mean they're essential to everybody. It doesn't mean they're necessarily on a list of absolute musts. But where you can keep things open, where they pose a very low to no risk, then I think most people would agree that's not a bad thing to do. The moment though that the risk profile of any given activity changes, that's when, and the data's telling you that, that's when you have to potentially make further changes.
Are you
You've had
considering tightening
1,300
restrictions
cases.
in regional areas?
Well, again, nothing is off the table. We look at our data all the way through. We've just made some announcements in relation to regional Victoria, some of which have started in that Geelong plus corridor at midnight last night. Others that will come into effect in terms of universal mask wearing from midnight Sunday night. But we're looking at all of that data. The numbers, it's different in regional Victoria. Numbers are obviously lower, but we want to keep them there. And again, that's where that detailed analysis. And look, to be completely and utterly frank, if the data tells us that whilst we've done an enormous amount, if the data says that's not enough, then we will have to take further steps. And if and when we get to that point, we'll take you through step by step, as we have every time we've had to make changes, what those rules mean.
Premier, 1,300 cases in 2 days.
Yes.
Isn't that enough evidence to say that what we're doing is not working, and that this time the greater action is yesterday?
Oh, look, we've kind of gone from people describing some of the decisions we've made as too much to then urging to go further. As I said before, there'll always be different views and there'll always be different opinions on when certain things should happen. That's not an unhealthy thing, but I think that following advice that's based on fact and data, not hunches, is a very, very important thing. Advice does change, circumstances change, and let's do that work. It's happening now, it'll continue today, tomorrow, and if we've got further announcements to make, we will. They'll be made in good time, but I don't think it's unreasonable to say that there are a whole range of potential next steps that will come at a very significant cost. And I mean that in all of its senses. So a well-considered process is always better than one that isn't.
Given that 1 in 4 people weren't home when the guys came around knocking, and obviously we don't know exactly where they were, but is there a concern perhaps that the government initiatives, the $300 to only get tested, people aren't taking it up, or they're just not sending the message?
Well, it's really hard to find, it's really difficult to understand why 1 in 4 people that were door knocked may not be there, weren't there, I should say. That's very challenging to try and understand that. Now, there can be some economic issues. We've talked about this many, many times over many, many days. That's why it is so pleasing to have 4,200 of those payments having been made. That number will continue to grow, and no doubt there are many other people. We know that insecure work and not having sick leave is a feature of not just the modern Victorian economy, but the modern national economy. It's something we're going to need to come back to at some point. But wherever we can identify a driver, then of course we're in there trying to provide support to deal with that, the thing that's pushing bad choices. But there may be a handful of people where the address didn't actually align. There may be a handful of people who are isolating somewhere else. But again, none of those quite logical points would explain the numbers that we're seeing. And it is our fear, and that's why it's been referred to Victoria Police, that there are significant numbers of people who are just not doing what they should be doing, and that is staying at home. It's important to be frank about that, but at the same time, I wouldn't want that to take away from the fact that the vast majority of Victorians are doing the right thing. They're making significant sacrifices, and they're making a big and profound contribution to our fight against this virus. The big question for the next few days is, are these rules enough? Do we need to do more? And if the advice based on the data says that we do, then we won't hesitate.
Would you consider using PSOs would you consider rolling out PSOs from train stations to do some of these checks to really increase the scrutiny of these people who are testing positive?
Those sort of operational issues would be for the Chief Commissioner, but
Would you encourage him to do such a thing?
well, no, it's not a matter of me encouraging him to make those operational decisions. I think that Chief Commissioner Patton knows and understands a whole range of different points about this. For instance, public transport usage is but a fraction of what it would normally be, and we have some really pressing challenges in other parts of the city. I'm sure that that's a matter that he's looking at. There may well even be some of that happening now, which I'm happy to try and come back to you.
Would you ask the social media companies to help you reach the people who aren't hearing your message? Would that be a sensible thing to do?
Uh,
I don't know, I mean, how do you reach
Yeah.
people who aren't getting the message, right? You're doing everything you can.
social media and sensible messages. It's an interesting debate. We probably haven't got long enough for that, I think. In
But they
terms
ended up
of,
understanding people's
we
behaviour.
get, look, we push out our message in multiple platforms. Social media is an important part of that, a very important part of that. And if you look at some of the views, some of the page reads, all the different metrics we get, whether it be my Facebook page, it is literally millions of people that are reached every day, and that's a really important tool. Just as print, radio, TV, multicultural media, door knocking, direct community engagement, community leaders, all of those sorts of things. So there's not a mechanism that we're not using. We're using all of them, and if there's more that can be done via engaging with, whether it be telecommunications companies or different platforms, of course we would always do that.
Professor,
You most certainly can.
every day we find X number are still under investigation. Do you have a percentage of the investigations where you still don't know? You can't do contact tracing. You can't figure it out. Is there a percentage of that?
So for the numbers that are under investigation, a majority of those have been interviewed. They've provided their close contact details. We haven't necessarily tied them off completely because there might still be a tentative link that's being explored to an existing cluster or outbreak or known case. So the numbers under investigation doesn't mean they haven't been contacted. The numbers that are contacted on a daily basis are essentially the cases that we're getting notified to us if someone's responding to that call, which is the great majority. So they are almost all covered on a daily basis, but the under investigation will keep that status until they're totally tied off.
So I suppose what I'm asking is referring to what the Premier mentioned before, the mystery ones. Is there a large percentage where you really just don't know how it happened?
They're not a large percentage, but they're not insignificant. I have got the number for today. It's an increase of 94 since yesterday that have been determined as community transmission. So where the source is not necessarily known, that has grown over recent days. So that's still a minority of our total daily cases, with the majority being known close contacts, known outbreaks and clusters. But the community transmission cases are a concern, and they are the ones that are addressed through the physical distancing, the restrictions that we've got with stage 3 and any other restrictions that would be put into place, because obviously it works for all of us across the population, regardless of whether we're known to be a close contact or not.
Brett, just on contact tracing, how many people a day at the moment are we managing to interview and determine their contacts? What's the average time it's taking to do that?
My understanding is that all notifications that are coming in every day are allocated for interview that same day, and those interviews are made or attempted to be made multiple times for every single case on that same day. So for the cases that are coming in through the previous day and into the night and overnight, they are allocated from early the next morning to be interviewed. There are those individuals who aren't picking up the phone or who have no contact. Hello, I'm still here. But the door knocks are part of the capturing everyone who might not be contactable by phone if we've got other contact details to be made.
How frustrating is it for you that you had modelling that showed we could have reached our peak on Monday and then we've just seen these cases go so far?
We're all rolling with the punches. No one likes numbers to be increasing. Everyone's hoping that the additional interventions that we've made all along the way will be kicking in, day out. To see it not turn the corner is absolutely a cause of frustration, not least because it's not just a number. These are people's lives, and we know what the consequences are and how tragic that is. So it's awful to see. It is somewhat gratifying to see the kind of modelling that shows that masks make a difference. It's also very gratifying to see that it must be more than 95% of people are wearing masks all of the time. What we can't necessarily be assured of is it happening for the population that we most need to reach, in those postcodes that we most need to reach, and at all times. Wearing it outside on your own, great, but not a significant driver of transmission. But in the workplace, when you're having your breaks with your workmates, is that distance being kept? Is everyone keeping their mask on all of the time? They're things that are not easy to understand, but it's certainly gratifying to see that, you know, the vast majority of people are wearing masks all of the time.
Right,
Did
so
you-
how
last
have
question.
masks have been working, even though we've seen numbers go up and transmission in workplaces?
Oh, yeah, I think it's fantastic that masks have been adopted as a kind of new cultural norm across the board, and now we're seeing it across Victoria. I think people understand that it's a small intervention to make. There might be people who feel that they've got a constraint on their liberty and need to protest it. I'd rather see them stand there naked with a mask on than not have a mask. We know that masks are a really important intervention for this virus that, let's face it, can kill the person that you're in front of.
My last question is just, last week you said that a New Zealand style lockdown could do more harm than good. Is that something that you still think in Melbourne?
Oh, so we're looking at what additional, you know, interventions might be. My point about New Zealand is that New Zealand went through a process of a very hard lockdown across multiple industries at a point where they had very little community transmission and much smaller numbers. It was a different circumstance at a different time where those interventions would have acted on transmission differently. We need to look at what our circumstances are in Victoria now, with a lot more community transmission, bigger numbers, and different populations affected in different areas. So we need to just see where we focus our attention on any additional restrictions or interventions.
Right, the management at St Basil's says that in exchanges with you, it warned that removing the workforce there wouldn't be beneficial to the residents. Is that your recollection of the exchange, and do you regret removing the workforce?
No, not at all. I wrote to St Basil's to say that we had to consider their entire workforce as close contacts, because what have we got to? 124 cases in St Basil's, and that's with the intervention. Without that intervention, with additional staff who were going to become positive over coming days, as they were, that's just more and more residents exposed and infected and dying. So I have absolutely no regrets about writing to St Basil's to say that they needed to change that workforce. What I did say is they should do so when an appropriate workforce can be mobilised. There was also reasonable excuse not to follow those directions. If they felt like there was an impossible situation where they couldn't get a reasonable workforce to transition, I would have been very happy to have that conversation. I wasn't involved operationally on the ground, so I haven't been involved in how that transition was made, but the recommendation was based on protecting those residents from staff who were already infectious or about to become infectious.
What data items do we collect when people are getting tested and when we're contact tracing? Things like, are they asymptomatic when they test positive? And why aren't we making more of that data publicly available?
We collect a lot of information about when someone's become symptomatic, where they've been in the 48 hours before they were symptomatic, because that's regarded as a potentially infectious period, all of their close contacts, all of their demographic details. That's part of what we use for our internal analysis. In terms of what we make available, I'm not one to hang on to information that might be of use to the general community. I think there's been a request for a more localised postcode data. I'm supportive of that, as long as it doesn't identify individuals or potentially identify individuals with a notifiable disease, because that protection of privacy and the knowledge that people can come forward for testing, get a positive result, and not be afraid that their information will become publicly available is a really important measure as well.
Brett, with all the restrictions in place, we still seem to be, as the Premier highlighted, a quarter of people aren't doing the right thing when they're positive, not the rest of the community. Is there time for something in that space to be done? Because otherwise all other restrictions seem pointless if people who had this virus are going out and disobeying the rules.
Yeah, I think in terms of being really clear that positive people need to be absolutely isolated, that's what we're working on right now. That's what the ADF are doing. I'm actually aware that they're going out multiple times a day. There have been people who've not been home twice in a day. That's not exercise. That's clearly being elsewhere. And I think that the penalties that are available having been referred to police now, will shift those behaviours.
Should that exercise right be removed for 2 weeks while they're in isolation?
No, I don't think so. I think following the directions on isolation will be absolutely sufficient to protect others. You just need to do the right thing, which is staying at home.
Take all doubt out of it just for that 2 weeks?
No, I think the issue that we're facing at the moment is that there are people who are going to work infectious, that there are people who are seeing others in close contact whilst infectious. That's where transmission occurs.
Can I just ask about the postcode data? You've said a few times you're totally okay with it being out. It's not.
We're working on it now. So there's, we've got a Power BI platform that can incorporate that. We need to work with the technical fixes that allows that to come through. But there's some ambivalence about people saying, oh, I need to know that it's in that postcode and not my postcode. So maybe I can behave in a way that doesn't recognise that this virus is across Victoria. It is across Victoria. I don't want people to have a false sense of confidence about not following all of the directions that are in place because they're in a big shire and they say, oh no, the cases are in that postcode over there. Maybe I can go and see my mates. I don't want that to happen, but I do think that the transparency about all of the cases across Victoria is reasonable, and I think it's it's a sign of confidence in the Victorian community that they can look at those numbers and that they can act accordingly, including following all of the directions that we have in place.
Taking that risk of complacency into consideration, and we know that obviously these last few days these numbers have been really depressing for the public to hear. Generally speaking, we know that the high numbers, high proportions are coming from those more vulnerable workplaces. In terms of the general community, how are we tracking?
Oh, so outside of those hotspot areas, we have seen an increase in cases, so there certainly is no need, or I wouldn't want to see any complacency for anyone, even if the risk is lower, because it only takes that single case, and if you're behaving in a way that says, oh, there's only a 1 in 10,000 chance of me running into someone else, that is where it all started. We started in this state with one case, and it grows over time if anyone thinks that they're not personally at risk, either of contracting it or passing it on to someone else. So everyone needs to have a laser-like focus on the fact that it's a collective responsibility wherever we are, whatever postcode, whatever cohort or group in the population.
Did the AHPPC recommend tougher restrictions at yesterday's meeting?
I wasn't on yesterday's meeting for AHPPC, but we always have conversations. AHPPC isn't there to recommend anything to Victoria. That's for Victoria to determine. We've got access to all of our very detailed data, but I would always welcome, and I do, the exchange with AHPPC with all of the expertise they have about things to consider. But it is for Victoria with the detailed understanding of our epidemiology about what we need to do for this state.
Brett, what concerns did you have about resourcing for the public health unit and contact tracing before the pandemic? Do you think we can play catch up on scaling up as a result of it?
I've said before, my focus is unequivocally on how to respond to this pandemic. I'm not in the business of providing commentary about historical matters.
I'll just, unless there's any other issues, I might just try and just summarise things. These numbers are too high. There are still some people who are not doing the right thing, and I would appeal to them, come forward, get tested when you're sick. Make sure you're following the rules. Make sure you're doing everything to protect yourself, your family, every family, and indeed our heroes, those who are working in our health system, who, if people continue to do the wrong thing and if we continue to see the spread of this virus, then there'll be more and more risk that they have to deal with every single day. To put it another way, the job that I have means I'm responsible for the things that don't go right, and I take that responsibility. But your responsibility as my fellow Victorians is to follow the rules and play your part. I'll do mine, and I'm asking you to do yours, and that is to turn up every day here and answer the questions and make the difficult decisions. But equally for every Victorian, you've got to stay at home. You've got to get tested when you're sick. We're all in this together. Whether we like that or not, we are all in this together, and we will all share in the benefits of getting past this, but we all must make a contribution to getting to that point. So, if you're sick, get tested. Don't go out. If you've got the virus, then you need to stay at home. If you need further support, we're there to provide that to you. Whatever you might need. If you need more information, more clarity, if you need anything, we will support you. But this is a shared thing. We are all in this together, and me and my team are working very hard. Thousands of people are working very, very hard, and I'd ask that Victorians join us, all Victorians join us in that effort, because that's what will keep these numbers lower than they would otherwise be. Mean there is less spread, less tragedy, less families having to plan funerals. If there's no other issues, I will see you tomorrow.
Thank you.